come to have fun. Yeah. We come to praise God. Yeah. And we get to worship Jesus. Yes, I'm so glad. Good afternoon, everyone. Welcome to the Small People Show with me, Aunty Vashti, where little voices make big sounds, and we laugh, we learn, and we love. Today is Tuesday, and you know what time it is? It's Edu Fantastic Tuesday. And I'm so excited about today's show. Today I have with me my new Edgy Fantastic Tuesday partner for the month of May. Her name is Jayla Johnson, and Jayla is 12 years old. She is the head girl of St. Francis Primary and Infant School, or feature school, for this month. Jayla is currently in grade 6. Her favorite color is purple. Hold on, y'all be liking purple. And fun fact about her is she loves to cook dishes that are noodles related. I want her to tell me some more about that. Good afternoon, Jayla. How are you?
I'm doing fine, thanks.
Okay, awesome. Jayla, before we start talking, I'm so interested. Or let me say this fun fact that you gave us. I'm really thinking about it because you said fun fact is that you love to cook dishes that are noodles related, right? So explain that for me.
Well, I like to make Alfredo and I like to
Okay.
make spaghetti and meatballs.
Okay. Oh, so because when when I was thinking about like noodles, I was just thinking about like ramen and and just the regular cup soup. But I mean, I was saying to myself, but you can't really cook those. Not like you specifically, but like you just need to boil water, put the noodles in, and whatever. Oh, but you're talking about pasta type of thing, or
Yes.
and you said spaghetti and meatballs. Okay, how did you learn to cook those meals?
Well, I have an auntie, she's actually a chef,
Mhm.
and my mom likes to cook, and I always go in the kitchen when she's cooking.
Oh, okay, nice. So you're good with this, cooking this meal.
Yes, Auntie Vashti.
Awesome. Okay, nice. I love it. Love it. That's awesome. Can you cook anything else?
Well, I can make corned beef and rice.
Okay. Yeah, go on. Okay. Tell me how you cook the rice in 10 seconds. How do you cook rice?
First, you wash the rice, then you put salt in it, then butter, then put it on a low flame.
She correct, Sarah?
You wash it, don't wear the water, you have to put it up with water after you wash it.
Exactly. You have to put.
But close enough.
But good enough. Very good. Alrighty, thank you, Jayla, and thank you so much for joining us on the Small People Show.
You're welcome.
Yes, awesome. Anyway, today we're celebrating World Asthma Day with some special tips on how kids can manage asthma and stay healthy. Right, and earlier Jayla and I was talking, and she said that is it okay if I mention it?
Yes.
Okay. She said that she has asthma. And how do you deal with it?
Well, my asthma doesn't act up on me recently,
Okay.
but normally when it does, I call my mom and she'll help me use my inhaler.
Oh, okay. Awesome. And today, this program is brought to you by the NCD Unit Health Promotion and Protection Branch Ministry of Health and Wellness. It's important that you know how to use your inhalers and spacers properly. That way, your medicine will get to your lungs and keep you feeling good. In Jamaica, asthma treatments like inhalers are available, and with the help of the NHF, they're easier to get. So let's talk about how you can make sure you're using them right. And if you have asthma or know someone who does, we want to hear from you. Right? You can call in and share your experience. And of course, today we have an expert with us, right? And her name is Dr. Crista-Lee Berry. She's consultant. She's consultant pediatrician, pediatric pulmonologist, Department of Child Health, University Hospital of the West Indies. So we're going to get right into it. Thank you so much for joining, Dr. Berry. Good afternoon.
Hi, good afternoon. Thank you, Aunty Vashti, for inviting me to speak to your listeners today about asthma.
Yes, it's
Good afternoon, everyone.
Good afternoon, Jayla.
Good afternoon.
Yes, and I also have a small person with me, and she will be talking with you as well. Thank you so much for joining us on the Small People Show. Also, you can join us on Facebook and on YouTube at Love 101 FM Jamaica, and we'll get right into it. By the way, guys, stay tuned and keep listening on the Small People Show for a chance to win some exciting giveaways. So let's get into it, Dr. Berry, and tell us what exactly is asthma and how does it affect kids' breathing?
All right. Well, I just want to say before I answer such a wonderful question, is that this day, as you had rightfully said before, the world is recognizing asthma and focusing on making all inhaled treatment accessible to everyone. I also want to say I'm excited to meet Jayla from St. Francis Primary and Infant School. That school holds a special place in my heart. My youngest brother recently graduated from St. Francis Primary and Infant. So nice to meet you again, Jayla.
Thank you.
But getting to your question, asthma, to put it simply so that all of our small people listeners can understand, asthma is a chronic or long-standing ongoing condition of the lungs in which the airways, and the airways are the pathways that carry the air down into our lung tissue so that oxygen can be extracted from the air and get into our body. Now, these airways are therefore very important. It's important that they stay open and not be blocked by anything. In asthma, these airways become easily narrowed and they get smaller due to inflammation, increased mucus, and the airways also frequently contract or spasm when they come in contact with everyday triggers, including dust, pollen from trees or flowers, strong scents, there's powder, smoke, cockroaches, and respiratory infections, just to name a few. All right. So the symptoms of asthma, though, are many. But I'm sure your Jayla has said that she has asthma.
Right.
Is any of what I've said, can you relate to it, Jayla?
Yes.
The triggers and the day-to-day narrowing of the airways,
Mostly the
symptoms
dust.
like coughing.
She was saying mostly the dust affects you.
Yes.
Oh, mostly the dust. Well, yes, that's one of the common triggers.
Mm-hmm.
And for children with asthma, they can cough a lot, and the cough sometimes is dry, and especially happens at night or in the early morning, but it can happen in the daytime as well. And there's chest tightness, shortness of breath, difficulty finishing your playtime or keeping up with your friends when they're running or even walking. And then there's also wheezing that can happen, which is like a musical sound that comes from the chest, and that's because the airways are too narrow.
Wow.
What are some of most common mistakes kids and their parents make when using inhalers, and how do we fix them?
All right. Well, some of the common mistakes that I've seen children and their parents do in taking care of their asthma overall The very first thing is not taking their pumps or inhalers as prescribed. So most children with asthma should have two inhalers. The first inhaler is an inhaler that most persons know. It's usually blue or blue and white.
Right.
And it has a medication called salbutamol in it. Most people in Jamaica would say Ventolin, right? But it has many different brand names in the pharmacies. Now, this rescue inhaler is taken when you are having asthma symptoms, or it can be taken before you play if your doctor so directs you. But the other inhaler is the one that a lot of people don't take seriously. And the other inhaler is your controller inhaler. And that inhaler is to be taken every day, whether you're having asthma symptoms or not. That inhaler can be brown, which has beclomethasone in it, or orange, which has fluticasone in it, or certain combinations of others. It could be purple, or some of our older children may be on a red inhaler. But regardless of which controller you have been prescribed, you need to use it every day because its role is to reduce the inflammation in the airways. And if there is less inflammation in the airways, then it is unlikely that you will have the narrowing of the airways that cause your asthma symptoms.
Right.
So that's the very first thing.
Right. Very important to note. So you take this even when you don't have any asthma attack.
Yes,
right.
That is the controller inhaler, even when you're not having an asthma attack.
Right.
It helps to prevent it from happening.
Right, right.
All right. The next common mistake is not knowing when your inhaler is finished. Now, fortunately, some inhalers have a counter on it that can tell you how much more puffs you have in the inhaler that has medicine in it. But some inhalers do not have this counter. And so it is important to know how many medicated puffs is inside your inhaler. And that is usually on the box that your inhaler comes in. Why is it important to keep track of every dose that you puff out? Because there is also another liquid in your inhaler called a propellant. And that other liquid will continue to be in your inhaler even after your medicine is finished. So for instance, if your medicine says it only comes with 100 puffs of medicine in it, and you've done 100 puffs, even up to 150 puffs, you will still be getting liquid coming out of it that smells like your medicine and looks like your medicine, but there's no medicine in it. So it's important to keep track of every dose that you puff out of your inhaler so that when your inhaler doses are finished, you know that it's time to discard your inhaler.
Right. Very, very important. Thank you so much, Dr. Berry. Very important. Yes. And if you're just joining us, thank you so much for joining the Small People Show. And it's World Asthma Day. And today I have with me Dr. Crista-Lee Berry, and she's telling us some more about this World Asthma Day, giving us some very important notes. So stick around and just continue to gather your notes, and it's really important. And I have with me Jayla, so she'll continue with the questions.
But I have one more mistake though, which may be near to your next question. Not using a spacer.
Right. Because that was actually the next question about the spacer.
Oh, yes. The spacer is very important. And a lot of persons, especially when you get a little older, you think, I can put my inhaler directly in my mouth. Now, there are some inhalers that are made to be like that. And we're not talking about those inhalers today. And if you have that special type of inhaler, your doctor would have told you how to use that one. But for the majority of our inhalers, those inhalers cannot just go directly in your mouth, or should not go directly in your mouth. There is a spacer, which is a container that you attach to your inhaler, and that allows for the medicine in your inhaler to become like air when it's sprayed out. So it's no longer liquid. It becomes like air, and that makes it easier for you to breathe it in and out without losing the medicine to the air or to the environment. And remember, the problem with your asthma, remember where I said it lies? In the airways.
Right.
So if you're breathing in and out your medicine easily because of this extra attachment, then the medicine will get directly to the space in your lungs that need it the most. And you would be able to feel better and breathe better. So when you next visit your doctor, small people, listeners, ask about your spacer if you do not already have one, and they can show you the proper technique to use your spacer.
Awesome. I hope you're hearing that, small people. That is from Dr. Berry. And of course, this program is brought to you by the NCD Unit, Health Promotion and Protection Branch Ministry of Health and Wellness. I mean, we don't really have to go into the question, Jayla, about spacer because Dr. Berry would have answered the question. And so, what I want to ask Dr. Berry next is some kids find it hard to take their medicine regularly, especially the preventer. What tips do you have for parents and kids to stay on track with their asthma treatment?
Yes, that's a wonderful question,
Uh,
Aunty Vashti,
uh,
because it's important to remember. There are some standard tips which I will give you, and my patients have told me they work. But I'm always excited when my patients come and tell me about the methods that they use to remember their inhalers, because some of my patients come up with such innovative and creative methods that work for their lifestyle. And so if you small people have your ways of remembering your inhalers, remember to share them with your doctor when you
yes.
next visit. But the tips that I will share will be one, using an alarm. And so a lot of you have access to phones, tablets, whatever it is, you can actually create an alarm and label it inhaler time or whatever it is you want to label it, and set the time for the time that your doctor has recommended that you take your inhaler. So most controller inhalers or your preventer would be twice a day, most of them. So it's in the morning and the evening. And so you could set your alarm for, say, 7 a.m. and 7 p.m. And then when your alarm goes off, then you'll remember to take your inhaler. So that's one.
Mhm.
The second one would be by association. Most of us remember things by associating it with something else that we have to do that day. So, for example, most preventer inhalers recommend that you rinse out your mouth after using that inhaler. And so I've had some patients who store their inhaler beside their toothbrush. And so they remember in the morning as they're about to brush their teeth, that's when they take their inhaler because they see it right beside their toothbrush. And then in the night before they brush their teeth for bed, they also see their inhaler and remember to take it. So remembering by association may also help. I would advise, though, not to store your inhaler in the car because extreme temperatures can damage your inhaler. But there are just different places you can store your inhaler. You could store it by the dinner table, so you remember to take it after breakfast and after dinner. So storing it by association may help you to remember.
Right.
Another way is keeping a diary. And so if you have a diary that you check every day and you tick when you take your medicine, then you will remember, oh, I have this to do just by ticking it. It doesn't have to be a literal diary book. It could be a little whiteboard that you keep on your fridge or in your room. And then you tick off on your to-do list the things you have to do and include your inhaler on it. One thing I would like to add here as well is that I know all our small people listeners are very responsible, but it is important that an adult helps you to keep track and ensure that you take your inhalers daily.
Right. Right. Very important. Thank you so much, Dr. Berry.
Can you tell
Sure.
us more about asthma medication available in Jamaica and how the NHF makes them more affordable for families?
Thank you, Jayla. Yes, I will. So the inhalers and interfaces as well as other asthma devices and medications are all available in Jamaica. The Ministry of Health aim aligns with the World Asthma Day, which is to make inhalers accessible to all. I have been reliably informed by the team at the Ministry of Health that medications and devices prescribed for asthma are free in the public pharmacies or drugstores, which are located all around the island. So yes, I said free. However, in addition to this, the National Health Fund card will allow you to purchase asthma medications at private pharmacies at a discounted cost. And guess what? Children and teens under the age of 18, they get a double discount. And so I would ask and recommend that all of my small people listeners ask your family if you have an NHS card, a National Health Fund card. If not, then the next time you visit your doctor, talk with them about your desire to have one and they will assist you from there.
Right.
So free in the public pharmacies, discounted in the private pharmacies.
Got it. Thank you so much.
Sure.
Dr. Berry, do you have any other questions for Dr. Berry Jayla, or that's it?
That's it.
That's it? Alrighty. Well, we actually have some giveaway questions, right? So based on, I hope you guys were listening, right? So you can be the lucky winner. Alrighty. And this program, by the way, is brought to you by the NCD Unit Health Promotion and Protection Branch Ministry of Health and Wellness. And you just heard from Dr. Berry, Dr. Crista-Lee Berry. She is consultant pediatrician and pediatric pulmonologist, Department of Child Health, University Hospital of the West Indies. And so we're going to go straight into the giveaway section, and Jayla will just ask the first question. Okay, so the first question is,
how often should you use your inhaler to keep your asthma under control?
Oh, that's a good one.
Yeah. How often should you use your inhaler to keep your asthma under control? How often should you use your inhaler to keep your asthma under control? I should give the options, by the way. Let's give them the options. So A
is once a week. B is only when you feel sick. C, as prescribed by your doctor every day if needed. And D, whenever you remember.
What's the answer? So easy. I mean, Dr. Berry spoke to us about it, okay? So easy. Alrighty, so let me repeat Jayla will repeat the question and the options. Let's go.
How often should you use your inhaler to keep your asthma under control? A, once a week. B, only when you feel sick. C, as prescribed by your doctor every day if needed. Or D, whenever you remember.
Yep, what is your answer? I would ask Jayla what her answer is. I would ask Dr. Berry what her answer is, but Dr. Berry knew that already. Okay. So in the meantime, we got somebody got it. You can just go right over on Facebook, guys, at Love on One FM Jamaica on Facebook and on YouTube, and you can just type your answers there. Juanita Mott. Okay. So, I mean, she's the lucky winner. Okay, so Juanita Mott, she says C, which is as prescribed by your doctor every day, if needed. I wouldn't put if needed because Dr. Berry said, listen, we need our pumps every day. Okay. But very good. Excellent. Awesome. So you are one of our lucky winners. Okay, the last question.
Well done.
Yeah, very good. Juanita Moat. Very good. Okay, the last question is
What is a spacer used for? What is a spacer used for when using an inhaler? A. To make an inhaler look cool. B. To help the medicine go deeper into your lungs. C. To keep the inhaler from getting dirty. Or D. To help the inhaler taste better.
Could you repeat the question?
What is a spacer used for when using an inhaler?
Mhm.
And the options are A. To make the inhaler look cool. B. To help the medicine go deeper into your lungs. C. To keep the inhaler from getting dirty. Or D. To help the inhaler taste better.
What is your answer? What is your answer? Okay, and our gift is courtesy of the NCD Unit Health Promotion and Protection Branch Ministry of Health and Wellness. Okay, so you will get your gift. So, Juanita, you're the first person who will be getting your gift. And who's next? Who's coming next? Okay. Novelette. Okay. And her answer is C. No, it's not C. It's not C. Go again. Stephanie Cole said B. Very good. Ding, 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 ding. You are correct. To help the medicine go deeper into your lungs. Awesome, awesome. And that is all for today. You can come to our location at 81 Hagley Park Road, right, in Kingston to collect your gifts. Okay? Awesome. Thank you so much, Dr. Berry, for joining us today. We really appreciate you.
Thank you so much for having me, and thank you so much for listening,
Yes.
everyone,
Okay.
and interacting so well.
Right? So awesome. Enjoy your day, Dr. Berry.
All right, you take care, Auntie, and take care, Jayla. Bye-bye.
Bye. And that is
Bye,
all.
small people.
Thank you so much again, Dr. Berry. That is all for today. The word for the day was wheezing. Yes. And yeah, that is all for today, guys. Thank you so much for sticking and staying with us on the Small People Show, where little voices make big sounds and we laugh, we learn, and we love. Okay? Catch us next time for more fun. Gotta go, gotta run. Bye.